BoomerLifeDrZokolSept6th2014Seg3. I'm the happiest girl in the whole USA.
Yeah, Donna Fargo, she's the happiest girl in the whole USA. You get people coming to the BC Periodental Health and Implant Center from all over the place, don't you?
We do.
Yeah.
Yeah, we get people flying in from way up north and interior BC and from the U.S. It's pretty awesome.
So they stay overnight sometimes and come and see you? And
well, we got about 2 or 3 hotels right around the office.
You certainly do, yes.
So people fly in, get their work done, fly back up north or wherever. And some of them, actually, we had a couple people fly over from overseas even. So it's been pretty amazing, yeah.
No, there's a lot of dentists out there who want to have specialty level or higher quality work done, and they'll, even though they're coming from other cities, they have no hesitation in sending it to us.
Wow. Before the break, we talked about some of the dentists in your office, some of the other gentlemen, and I was thinking it might be kind of a nice thing if we can get them to come on the show one day. What do you think? Ask?
I'll ask them, definitely.
You think?
Yeah, they're busy men, but we'll see how it goes.
All right, I'm looking forward to that.
Absolutely, that'd be kind of fun.
Actually, I think it would be too. So let's talk about implants again. Somebody's just tuning into the show. They're saying, hey, these guys are talking about false teeth. Well, we're not exactly talking about false teeth, are we?
No, we're talking about something that's much more beyond a denture. We're talking about something where it's a fixed set of teeth that you can use and feel, and it's going to restore most of what you would have had if you had your own teeth.
And we're talking about lifestyle too. Happy people.
Yeah, absolutely.
Like that girl there, the happiest girl in the whole USA. Because how happy can you be if you have like bad teeth? Because your hand's up in front of your face all the time, you're hiding behind books, whatever, right? Yeah. So you get people that come in here to see you in the office. They're not feeling too good about themselves, but they leave and they're feeling darn fine.
Absolutely. We try our very best to make sure that people are happy with results, and when they're done, they get what they want.
People go to the dentist quite a lot. Some people don't go at all, but some people go quite a lot. And sometimes the dentist, we won't mention any names, will make a mistake, perhaps.
Sure.
Do something that they shouldn't do. Do you folks ever have to take care of those kind of problems for your patients?
Far too often, actually.
Really?
Yeah, we'd rather not see those type of situations, but inevitably somebody has to take care of the things that don't happen well.
Without mentioning any names, can you give us an example of some of the things you've seen in your office?
I think some of the without getting into real specifics, I would say some of the things we see is an implant placed not in the right position, tissue and bone or things are not prepared in advance or correctly, so that we're not getting a very good aesthetic result. Sometimes it's not putting the restoration on so that things will be aesthetic and functional. Let's put it that way. So I think there's always things, and Ron and I, we deal with this every day. Every day we get cases where some things have already been done or have been attempted or tried. And you know what? We all live in glass houses. We've always got to do what we got to do, and I'm sure that the person that was doing this work was doing their very best when they could. So we're trying our best to make sure that we take care of things. But in general, we see it every day.
And one of the things we want to do to those dentists, and there's a lot of dentists out there who are well-meaning and such, what we want to do is help them grow and understand, so they don't make the same mistakes again. We have a desire to increase the level of our profession in its ability to serve the public well. So it's not only what we do, but how we can help other dentists become better.
I don't want to make any jokes here, but let's say somebody from the general public goes to see a dentist, and we're talking about implants, and how does that person know if that dentist is the right person for them?
You know what? I actually had one of the people that works for the Pacific Implant Institute tell us today, for the same exact topic, what she tells her friends. If her friends goes to see someone and they're not in town and they're in a different province, different country, well, how do I know? Well, you ask them, how many have you done? How often do you do this? Can you show me some of the cases that you have done, right? And is there someone that you think I need to see a specialist? Those are the kind of the 3 or 4 things, and it's pretty. I think those are good questions to ask. I think that if I was going to go get anything done, I'd be like, well, how many of these have you done? How often do you do it? And can you show me some of the stuff you have done?
See, I think that most people, they go to see a dentist or a doctor, a medical doctor, they're afraid to ask questions because you guys are the almighty when it comes to the health. I can't ask the dentist these questions. He'll throw me out of the chair.
I think that's changing, Tom.
Is it?
Yeah, I think so. The internet has changed what we do and how we do things. The fact that people will look up information and ask questions, so they're going to be privy to an awful lot more information than they were in the past. We're starting to see people taking responsibility for their own health, and they are coming up and they are asking some of the difficult questions, which I think is actually pretty good.
So you don't mind?
Oh, heavens, no. The more we can communicate with our patients, we can find out where their priorities lie and what they're looking for. And if they have any concerns, what are they? The more information we have, the better we can serve.
It's amazing because sometimes someone will come, whether it be a teeth in one day case or a larger, more involved case. We'll do a consult, we talk about it, we give them an estimate, and a lot of times, sometimes they're not going to make a decision right that day. It's just a lot of money or a lot of work or a lot of time, and they got to think about it. Those are the times where I always book a second time for them to come in. It still doesn't cost them anything, so you can sit down and talk about it. But also, I tell them, make a list of questions. Go home, think about it, talk to your family about it, and make a list and bring it in so we can talk about it. Because the worst thing, is that if someone goes through something and they don't feel informed, they don't feel like they're not going to get what they want, or they're unsure. We want to make sure that when they embark on a journey, that they're really happy with what they're going to get, and they have a good expectation.
So they feel empowered.
Absolutely.
All right. Now, let's just suppose that somebody is tuning into the show. That we're halfway through. And they say, hey, you've got a couple of dentists on there, and they're talking about implants. Well, we're talking about BC Perio Dental Health and Implant Center.
Yep.
And we're talking about your consultations, which are free, gratis, don't cost a thing.
Mm-hmm.
Absolutely Zippo. Cost nothing.
That's right.
How much does it cost me, though, if I decide I go and see you fellows and I decide not to get the work done?
Zero.
Still.
Yep.
Zero.
Yep.
No obligation whatsoever.
No obligation.
Mm-hmm.
This is pretty cool.
Well, it's good. The best thing is that when you come into the office, you get your options, right?
Mm-hmm.
That's pretty awesome.
And I can ask some questions.
Absolutely.
All right, so I'm a first-timer. I come there after my coffee. I brush my teeth. I go and sit in the chair. And what do you do to me?
Well, look.
Okay.
And ask questions.
That's good.
So we gather information.
Yes.
And part of that comes from conversation. So there's a medical history that you'll fill out. We'll get an idea of your ability to tolerate the procedures that might be necessary for you. And we'll talk about where your priorities lie. The x-rays will give us information that we can't see when we look in the mouth. And when we look in the mouth, we can see other things as well. We put all that information together. We correlate that with what the patient is looking for. So we try to establish all the little things that are not right. And we make a note of that. It's not to say we're going to do something about it, but at least we'll have a comprehensive understanding of what we would do in a perfect world. And then we listen to our patients, and then we see where their priorities lie and see if we can create a solution for them that matches their desires and priorities.
So your prospective patients come to see you, and it's kind of like they ask you questions, you ask them questions, you get to know each other?
It interviews both ways. I mean, they're looking for somebody who they can trust and rely on. And sometimes it doesn't fit very well. So they're evaluating us as well as we're evaluating them.
And again, people will think, well, I come for a procedure. It's going to take a long time for my mouth to heal, but that's not the case. Things in your mouth heal quickly?
No, they do. The reason why is because your mouth, the tissues in your mouth are very vascular. You have a lot of blood in there, a lot of supply. So things heal really quickly. Think about it this way. You get a pizza burn, right, from a piece of pizza, and the roof of your mouth, think about how long it takes to heal. Maybe a day.
Yeah.
Right? Now, if you had that on your arm, it would take a week, maybe 2 weeks.
That's true, too.
Okay? So
Yeah.
it's one of those things where things in your mouth just heal faster.
I bite myself and wake myself. You ever bitten yourself in the middle of the night and you wake yourself up?
I've never done that, but I can imagine.
Maybe I shouldn't be saying that to these two guys. They say, come and see us Monday, Tom. I'll be at the
Monday, you got to come see us, Tom. Something's going on.
There's something going on there. It can't be right. 777 West Broadway. That's your new location here in Vancouver.
That's right.
All right, and people want to make a consult. What's the word I'm looking for here?
A complimentary consultation. There we go.
Complimentary consultation. Absolutely. 604-872-0222. Correct.
That's right.
Now, if somebody lives in the Coquitlam area.
It's 604-936-8244.
Okay. A lot of people say, gee whiz, I don't know if I have the money available right now. Do they have to pay it all up front?
No, it's things are paid as you go, and more than anything else, your consultation initially is complimentary. So it's worth coming in to get your options.
I guess.
Absolutely.
I think they say knowledge is power. What we do is provide you knowledge about yourself, and now you can make an educated decision of what might be in your best interest.
Wow. It's pretty exciting stuff.
Mm-hmm.
I guess you're glad you're doing this for a living, eh?
It's enjoyable. It really is. It's fun because a lot of what we do is empowering for people, and people really do change the way they live their life a lot of times with the fact that they feel confident or they feel comfortable.
Give us a quick story about how a visit to you folks there at BC Perio can change a lifestyle. You told us a story about a woman that came in to see you last time or several times ago, and you did a procedure on her, and it just changed her whole darn life.
Well, I can tell you a story about a lady that we did something for. She came in. She had advanced disease, and she had some teeth left in the upper and lower jaw, and she had basically limited her diet to about 6 foods. You know, she said, I can eat soft bread, I can eat some soft fruit, smoothies or shakes of any kind, and then the odd time I can have some ice cream and something else. Because it wasn't just a matter of having soft foods, but it was also about how sensitive things were, right? If it's hot or cold or sweet. And so that's really hard to live your life surrounded by, you know, 5 or 6 things that you can eat. So she came in and we discussed things, and we actually provided her with teeth in one day for the upper and lower all in one day. So we did her whole entire mouth. So she came in and we took her teeth out, put implants in the top and the bottom, and we were able to give her some fixed set of teeth, a fixed set of bridges, upper and lower, in one day. And when she walked out that day, the way she looked, first of all, she was in tears, but her daughter was beside herself. Like, we had to kind of hold it. She was very, very emotional, because to see your mom get that kind of treatment and have her look that way, and to see your mom confident and happy again, and everything else is just, it's great to see, as a kid to see your mom that way. And her daughter wasn't, like, you know, she was probably in her 20s. It's just a huge experience for them, and we've seen them back since. And you know, she's quit smoking, she's lost weight, she's taking better care of herself. It's a really a life altering thing. It really can be.
And Dr. Zokol, you told a story about a patient came to see you. You did a few procedures. Then after, she was feeling pretty darn good about herself. She went and got a new hairdo, got some new clothes, got some shoes, and became a party animal. got a guy that was 25 years younger than herself. You remember this one?
Yeah, I certainly do. Absolutely. She married somebody literally 20 years younger than her. She was 45 years old when she started. She was 48 when she finished everything. And the man she married was 28 years old.
Wow.
And I go, you got to be kidding.
So obviously you do good work.
That's awesome. I like it.
I changed lives. And there's another case, you know, many years ago that I treated, and the gal was brought in by her husband, and they were in their 60s, and she was losing weight because she couldn't eat properly, and she couldn't nourish herself. And I'd had a chat with her physician, and her physician said she's malnourished and she can't eat properly, pain in her mouth and difficulties there. So we ended up going ahead with treatment, and once we fixed her with fixed teeth, she started to regain her weight back. And her husband and she, they attributed her continuing life to the fact that she had dental implants and solid teeth in her mouth. Now, that's an extreme case.
Sure.
But it still is life-changing for her.
It's pretty cool. And we talked about this. We said that your face has to stop growing before we can go and see you guys. Let's go to the other end now. What if let's say somebody's in their 90s?
I did implants for someone that was in their 90s in July.
Really?
Yeah. You know, I've placed implants for them. One of them, she got teeth in a day. The other person just got, you know, implants, and they're going to get some crowns on their implants to replace some teeth. But you can be as old as you're alive, as long as you're medically healthy and you're able to come in, and we're able to provide the services for you.
You can be as old as Methuselah.
Absolutely.
All right. What are the 6 most frightening words in the entire world? 6 most frightening words in the entire world.
I'd say one is oops.
No, they are. The dentist will see you now. You're listening to Boomer Life. We've got Dr. Bobby Birdie and Dr. Ron Zokol, and we'll be back with more right after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.